There's not just one magic sauce to anything. It's always a combination of all of it.
I had a rough first pregnancy. I realized that acupuncture and Chinese medicine can do so much healing. Acupuncture really helps in this instance. It's bringing circulation to different parts of the body, decreasing any kind of inflammation.
How about general women's health? How does acupuncture and Chinese medicine help that?
Acupuncture can seriously be used for almost every kind of ailment. It's not going to hurt, right? It's just going to help your body heal quicker than it normally would. We're always going to treat the underlying woman's health issue that is preventing you from getting pregnant.
If you could give a word of advice to someone that's having trouble conceiving or having a baby, feels that there's no options.
There's always somebody out there that aligns with your thoughts and what you want. Just be open to finding that person and being open to trying new modalities.
Welcome to the HealthFit Huddle, where we keep you mobile and active away from painkillers and surgery so you can get back to the things that you love. I'm Dr. Jason Han, CEO and co-founder of HealthFit Physical Therapy and Chiropractic. Today, I'm joined by Dr. Zen Tuan, founder and CEO of Healing with Zen, also located in Pasadena, California. A little bit about your business. You strive to share the healing power of Chinese medicine and acupuncture, allowing you to unlock your best self physically, emotionally, and spiritually. So happy to have you. Welcome to the Huddle.
Thank you so much for having me.
Okay, so let's get into it. Can you share a little bit about your background? What led you to specialize in acupuncture, particularly in women's health and fertility?
Okay, so I actually found acupuncture much later in life. I used to snowboard in my 20s, and I had a snowboarding injury. And I was introduced to an acupuncturist at that time who was a teacher at a school. And I was just amazed. He treated me in front of a group of classmates or students. And I was just amazed with one treatment. My range of motion was better. I felt better. And I knew that I had stumbled across something I really wanted to learn more about. So from that point on, I looked into a master's program and I jumped right in and got licensed. What really got me more into women's health and fertility was my own journey with pregnancy. I think going through my own struggles, I had a rough first pregnancy. I realized that acupuncture and Chinese medicine can do so much healing. And so that's why I'm here to share that with the world now.
Wow, I didn't know that. We've known each other for a while. And it's kind of interesting when finding the underlying whys of why we do what we do. And I want to go back to when you were snowboarding. Were you into medicine?
No, actually.
What was your...
I was doing I was in business. I was a product developer, so I was traveling a lot to China. And during that time, I was not very health conscious. I think I got more into my health during my pregnancy and afterwards.
Interesting.
Yeah.
So, did you know that me and Kelly went through IVF?
No, I actually did not know that.
Yeah,
I had no idea.
Yeah, that's why this is very, very interesting for me because through our struggles, we went through 2 rounds of IVF, didn't work. We went to a different doctor, and I forgot somewhere in that journey we started to integrate some acupuncture into it, and yeah, it's. We talk about the whole trusted professionals community and how it all works together. There's not just one magic sauce to anything. Mm-hmm. It's always a combination of all of it. So tell me a little bit more about what acupuncture is and were you a general acupuncturist and then you kind of specialized in
Yeah,
women's health?
absolutely. So when I first got into acupuncture, because I use acupuncture for my own recovery, for my own injuries, I became really good at treating pain. So, I got really good at treating neck and shoulder pain, a lot of jaw pain, and things that came along with that. So things like tinnitus or, like a lot of pain-related things. And it wasn't until my pregnancy, because I suffered a lot of pain myself, I realized that acupuncture could help a lot with things like back pain and whatnot. And my second time I got pregnant, it was actually, they call it a chemical pregnancy, kind of like a miscarriage early on. So that was really hard. So by my third time, when I finally got pregnant, I was doing all the right things. I was getting my PT, I was getting my chiro, I was getting acupuncture, I was doing my massage, eating really well. And I feel like all my experience really helps when I treat patients now. I even came out with a video series called Pregnancy Companion, which is just a weekly video that I did throughout my pregnancy to explain what's going on and giving tips about how you can make your pregnancy better.
So you've been, I'm sure you've helped hundreds and thousands of women. What would you say are some of the big struggles that they have? Not just, yeah, they have back pain, yeah, they have this and that, but like you as a mother, you as someone that's been through it, like what kinds of feelings are they having during these episodes?
Yeah, so like you said, you came from the IVF struggle, right? You went through a lot of ups and downs with that. How acupuncture really helps in this instance is it's bringing circulation to different parts of the body, decreasing any kind of inflammation. And what I say is we're always going to treat the underlying woman's health issue that is preventing you from getting pregnant, whether that be, PCOS or ovarian cysts or fibroids or endometriosis. A lot of times the acupuncture and herbs need to address that first, because once we do that, you're going to have a better chance of getting pregnant. So whenever I see a patient, we discuss that first, so we treat the underlying thing, and then we work on the fertility journey. And it does take some time, with fertility, as you probably experienced, is a lot of trial and error and a lot of emotions that go with it. I think one of the things that acupuncture helps most with in this fertility journey is just to calm the sympathetic system, because there's so much stress that's involved with what time of the cycle we should be having intercourse and when should we time this and time that. And I think that both parties usually become very stressed out. And I see that just by de-stressing the body, getting the body out of sympathetic system, a lot of times patients are able to naturally get pregnant that way.
Yeah, now that you're talking, I'm reflecting on our own journey. It was our first year in business here at HealthFit, so
stress was high.
Stress is high. We're trying to have a kid. We went to one doctor first, and then I was so stressed with the business because it's not cheap, right? It's quite expensive to do something like that. So in a lot of ways, my focus was more on the business instead of my wife, right? But it's the whole thing. I'm trying to have enough money to provide to afford this thing. And after the first 2 times it didn't work, yes, I now that we're looking back, it's like your sympathetic nervous system is on fire.
Not to mention the girls have gone through so many hormones fluctuations, right? Because you're injecting all the hormones and they're telling you, next we're doing this and next we're doing that. We're really bound to their schedule and having to make your appointments early in the morning, right? Or whenever they're scheduling you. So I think when I see a lot of the patients, they've already gone through the trial many times. And they're like, I don't know why it's not working. Maybe they're having chemical pregnancies or miscarriages. And my goal is to really support their body so that they're able to make it to the end. It's not just about getting pregnant. It's about having a healthy, happy baby at the end, right? And a successful labor too. So,
can you give me an example of someone that stands out to you, or maybe someone recently that you've been able to help from a fertility standpoint?
Oh man, I have a really sad case right now. This patient has had several IVFs and was unsuccessful, and she got pregnant with me naturally. It was very, very emotional when she got pregnant, and she actually made it to 21 weeks, and she had to abort. Yeah, and it really, really breaks my heart. But the one thing she told me is that she decided that she wants to keep her acupuncture treatments because she feels like it helps her so much on a emotional level to help deal with everything that happened to her body. So, I mean, I feel grateful that I can be there to help her, but it's hard too. It's a hard journey, and I'm very hopeful that she's going to get pregnant naturally again, and we'll make it to that next time. But now we both know what she needs, extra support and whatnot, so.
You speak, I think in our line of business, we put ourselves in situations which are quite difficult, right? And I think being empathetic, it's very hard to separate yourself from the person or the people you're trying to help. How do you manage that expectation, and just you have your family too. You have to be able to go home and be there for them. You're the mom. So how do you manage your own stress?
How do I manage my own stress?
Or situations like this?
I mean, I think first of all, you do get very vested into the patient's lives. I'm seeing my patients often, once or twice a week, and we establish almost a friendship almost, right? So it's really hard when they go through stuff. I feel like I go through this stuff too. And things I do myself, self-care is huge for me. I do acupuncture myself. I make sure I exercise every day. I'm trying to eat as clean as possible. I'm trying to do all the things myself so I can be strong for my patients.
You spoke a bit about one of the primary things is you're giving them herbal remedies to create a good base. You're giving treatments to lower their sympathetics, raise their paras. In what other ways does acupuncture help with that fertility process?
So we really help by balancing out the hormones in the body. It's not just about your levels, like what's your progesterone and what's your estrogen, but it's really the ratios of how it's working in your body. And we want it to be as balanced as possible. So acupuncture also releases a lot of the feel-good hormones, so like the endorphins, the serotonin, that type of thing. So people always experience a sense of relaxation when they're in the office and they take a little nap and they leave feeling more refreshed. More so, I feel like we work on the lining. When people are trying to get pregnant, we work on the underlying issues like I mentioned. So if we're treating cysts or fibroids, I really focus on like strong Chinese herbs to help move it and get it out of the body if we can, break it up.
Very interesting.
Yeah.
Kelly would understand this a lot more than I do, but it is very interesting. So it's all along the same topic, but yes, we have fertility. How about general women's health? How does acupuncture and Chinese medicine help that?
Yeah, it's really not until I got into acupuncture school that I realized that acupuncture can be used for so many things, right? So, like, let's say we're talking about fertility, but when they're pregnant, we're focusing on strengthening their body and helping them feel good. Postpartum, there's a lot of new postpartum aches and pains that show up too. Your thumb pain, deporvos, like shoulder issues because you're looking down at your bundle of joy all the time when you're breastfeeding. So there's so much that acupuncture can really help with, not to mention later on in a woman's journey when they are going through menopause. So many hormonal fluctuations. I treat so much hot flashes and emotional changes, and all of a sudden they're like, Zen, how come I'm gaining all this weight and I can't shed it? So, in a woman's life, there's so many things that you go through. And acupuncture can seriously be used for almost every kind of ailment. It's not going to hurt, right? It's just going to help your body heal quicker than it normally would.
When you were talking about postpartum care, I know a lot of my friends and their wives with postpartum depression, dealing with stuff like that. How does acupuncture, can it help those kind of things?
Absolutely, yeah. A lot of the patients that come after their pregnancy are not only dealing with the pain, like you said, but the emotional changes of becoming a mom. And a lot of times, postpartum depression, postpartum anxiety, these are all real things. And it's nobody's fault, but a lot of it is the hormone shifts, right? So helping them regulate their hormones and helping them, by releasing the feel-good hormones, like I mentioned earlier, it really helps them feel better faster. I'm not going to lie, I went through that too, right? Like, I remember after my first pregnancy, I cried every single day for a month. And it's not that I was so sad or so angry or anything. It's just you're overfilled with emotion. And so by helping the body balance better, I think a lot of my postpartum moms feel better when they notice that change.
You gave us an example of someone you were helping with fertility. As far as postpartum care, is there anyone that stands out in your mind?
Yeah, I had a mom come in, and her main concern was she always wanted to breastfeed. And once she got to that point, she was struggling with getting the milk out. And so I used some ear seeds, which is essentially little stickers that we can put on acupressure points, certain parts of her body. So I would tell her to go home and massage it. I gave her acupuncture. I gave her herbs, my vitality tea, and some other things. And before you know it, next week she came back. She was like, wow, I started pumping and I started noticing more, like, give me more, I want more. And so I think people don't realize that either, that acupuncture can help with things like breastfeeding and milk production.
I think what I'm hearing too is that you have amazing relationships with your patients. And
I'm so lucky.
Yeah.
I think that I have the best patients.
and I think it's quite important to have, whether it's going to you or for any other healthcare practitioner, to have someone that's actually able to listen to you. And those aha moments just come with conversation. Like you're thinking one way, but something that they say kind of highlights something else. So that's something that we have some mutual clients, and that's one of the big things that they've said about you and your care and in your entire team.
That's great feedback. Thank you.
Yeah. As far as integrative care, I think you said it yourself when you were going through your pregnancy, you went to different providers.
Mm-hmm.
What other modalities or expertise do you feel works well with acupuncture?
Well, I love referring patients for physical therapy. I think I can treat a lot of pain, but if somebody consistently uses their muscles or their body in the wrong way, we need to correct that first, or the pain's going to keep coming back. So I love referring to physical therapists, chiropractors on occasion. Mm-hmm. Sometimes I've had patients tell me other things, that's why. Naturopathic doctors I love. I love working with the holistic health team. For my pregnancy, I was able to have a successful home birth, so I relied heavily on my midwife and my doula, and
nice.
It was amazing. Like, they gave me so much knowledge and guided me, and I have so much respect for them too. And there's just so much alternative healing stuff that I'm still exploring. I don't know everything. Mm-hmm. I did Reiki recently to try it out, and there's massage therapy, obviously, and there's just so much that it's so fun to learn about. And I always put myself as a guinea pig before I recommend to my patients.
Mm-hmm. With Mia, our daughter, most of the pregnancy was at a birthing center. So in the tub or the jacuzzi thing. And then
was she born in the birthing center?
She was doing very, very, very well. And then what does it go to, 10 centimeters?
Mm-hmm.
Again, it shows
10,
how much.
yes,
Yeah,
10.
So 10 is like, but I think it was progressing very, very well. And then she got stuck at like 7 centimeters for a long, long time. Mm-hmm. Blood pressure went up, and it got to a point where we just went to Huntington, which was close by. But at the end of the day, it was more structural. My daughter's hand was here. So she couldn't get out.
So it was a C-section?
No, natural.
Oh, still natural.
Yeah,
Good.
natural.
That's awesome.
They epidural. So so it's how much I know. They did an epidural just to calm Kelly down. She was able to take a bit of a nap, and then they tried to induce her more with Pitocin. And it was a long pregnancy, but it worked out. But it was natural, and that was one of the biggest things that Kelly wanted. And then some of the stuff that she strives for her clients too, right? She does prenatal chiropractic, and it's quite gentle from the Webster technique, however you want to. Again, I'm not an expert when it comes down to it, but.
What about your son?
Son? He
was
natural.
Natural as well?
Yeah, natural. And we went to a different physician that was a little bit more in tune with the way that we were seeing things. We ended up going to hospital, but it was, no epidural. It was natural.
Good for her. Second time was natural.
Yeah, second time.
No epidural. That's same as me. The first time, it was a very similar experience. It was at Huntington Hospital too, and all the things were very similar. Like, they ended up giving me the epidural even though I didn't want it, but it's because all these other things were happening that were unexpected, and then the baby stopped, and then they did the Pitocin, the same exact thing, but she was natural, and I knew that that's not what I wanted the second time, which is the only reason I looked for the midwife, and I was able to do it at home.
Yeah, it's been some time now, like Maverick's almost 5 now, so 5 years since at least my second kid was born, so it's like I kind of forget about these things, but it's like weird when I'm just talking to you and they're all coming up.
It all comes back, and I feel like I go through this with my patients. Every time I'm going with a new patient and I go down that journey, I remember everything myself. So it's cool. Yeah. It's nice.
If you could give a word of advice to someone that's having trouble conceiving, or I don't even know that's the term, having a baby, what would you say to someone in that situation that's having a hard time and just feels that there's no options out there?
Oh, there's always somebody out there that aligns with your thoughts and what you want. Just be open to finding that person and being open to trying new modalities, because even if you think that you've tried everything, you really haven't. There's so many other things, other people you can talk to that can give you new perspective.
Mm-hmm.
And when it comes to acupuncture, I always tell couples to come together. I feel like when I treat both parties, whether it be male, female, male, whatever it is, you get a better result just because everybody's more balanced and feeling better.
Mm-hmm. So for all of our viewers and our clients, how do they find out more about you and your practice?
You can find me on social media. I'm on Instagram and YouTube under Healing with Zen.
Mm-hmm.
And my website is healingwithzen.com.
Yeah, 100%. So like, I feel that acupuncture was a big part of our journey, and a lot of the clients that Kelly sees, she feels they need the other side too. So we're more than happy to have you as part of their journey as well, and then the results kind of speak for themselves. So I appreciate your time. I appreciate you being here.
Well, thank you for having me and sharing all your story as well. Yeah.
I think more people need to know. And I'll sidetrack as far as it's such a sensitive topic too. Mm-hmm. When it's a sensitive topic, people don't talk about it. People feel like they're on an island. Mm-hmm. But the truth of the matter is there's a lot of people going through this. And the more that we talk about it, the more people feel comfortable reaching out and going to someone for help. And I think that's super important to do.
Mm-hmm. Yeah, especially like I told you, the patient at 21 weeks, that's really far. You're already halfway into your pregnancy. And to feel lost at that point, just to know that there is support. There's other people that can help you and will help you get through it. So,
Well, I appreciate your time. Thank you, Dr. Zen, for being on the HealthFit Huddle. And then we'll see you next time with our next episode. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.